Hi there, welcome to APP virtual lectures. My name is Gali. I'm going to be talking about frown line treatments with neuromodulators today. Again, my name is Gali. I'm a key opinion leader and national trainer for Mint PDO Threads, Evolus, Prolinium. I'm on faculty with South University, Medical University of South Carolina, and I've been injecting for quite a few years now, and I really enjoy it. So I'm excited to do this lecture for you guys tonight. So how do neuromodulators work? Botulinum toxin is derived from Clostridium botulinum, and acetylcholine is a neurotransmitter that controls the muscle movement. So botulinum toxin blocks the release of acetylcholine, which temporarily relaxes that muscle movement. Gradually over the next 3 to 4 months, the neuromodulator will slowly be eliminated from the body and muscle activity will return. And that's typically when we'll go ahead and retreat patients. Currently on the market, we have 4 neuromodulators. They're FDA approved for usage: Botox, Dysport, Xeomin, and Jeuveau. All 4 of the neuromodulators work very similarly in that they're temporarily relaxing the targeted muscles to limit movement and soften fine lines and wrinkles. Results typically start to appear within the first week with all the neuromodulators, and we'll wait about 2 weeks for full treatment to take place. Results will last about 3 to 6 months, and retreatment is usually recommended every 3 months. Now, between the 4 neuromodulators on the market, there are some slight differences. That's more for the provider. Honestly, the Jeuveau is most precise. It is very targeted. It doesn't have a lot of dispersion. Dysport is the complete opposite. It has a lot of dispersion, so it's great for areas of large movement, has the widest spread. And then Xeomin and Botox, Xeomin differs in that they do have accessory proteins, so it's great for patients who have stopped responding to the other neuromodulators. And Botox has been around for a very long time, so there's a lot of long-term studies done with them. Overall, I would say they're all wonderful neuromodulators and they all work very well. It's just really critical that whoever is doing the treatment, that they understand the different characteristics of each one when they're making their treatment. Botox, Xeomin, and Jeuveau are, I would say, they're dosed very similarly, and Dysport's a little bit different because of their dosing. So let's do a review of basic facial anatomy. So like I said, today we're going to be covering just the glabellar complex, the 11s when you make that angry face. But in general, neuromodulators, we use them a lot in everyday practice. The most common areas to be treated are the forehead, those horizontal lines between the brows and the crow's feet around the eyes. But I use them for nasalis treatment for the little lines around the eyes. I treat them to soften the little wrinkles in the lower lid there. We can treat the chin dimples. We can do a little lip flip to give you a little bit of height in your lip. We treat perioral lines. You can even treat the masseter muscle to slim down the face, or if they have bruxism. So there's really a lot of different things that we can treat aesthetically and in the face. But like I said, today we'll go ahead and cover the glabellar lines. So the glabellar complex, it's comprised of the procerus, the corrugator supercilii, and the depressor supercilii. And those are going to be the muscles that we're going to be targeting to soften those 11 lines that we get when we make that angry face. So for patient assessment, we're going to go ahead, when your patient first comes in, you're going to go ahead and take a look at them without any facial expression while they're talking. Just kind of take a look, see, do they have any fine lines in that area already? Or do they have a deep crease, a little furrow that's coming through? And then go ahead and have them make that facial expression. Ask them to make an angry face and see where the muscles are really pulling. Typically you'll see the procerus kind of pull down and the corrugators will pull, and you'll see the head of the corrugator and the tail end of the corrugator there. And this is a time when you'll be able to assess how many units you'll be dosing that patient with. with, like I said, Botox, Xeomin, and Jeuveau, they're very similar. They come in 100 unit vials, and Dysport comes in a 300 unit vial. The dosing is different between those two, between the Dysport and the other 3 neuromodulators. Botox, Xeomin, and Jeuveau, they all come in 100 unit vials, and Dysport comes in a 300 unit vial. So dosing will vary slightly between Dysport and the rest of the neuromodulators. So when you're reconstituting, you can go ahead and add 2.5 mLs of preservative-free sodium chloride. The preservative-free sodium chloride is going to make for a much more comfortable injection for the patient. So you don't want to use bacteriostatic water for this. And then your concentration for Botox, Xeomin, and Jeuveau will result at every 0.1 ml will be 4 units. And for Dysport, every 0.08 ml is going to be 10 units. So for a typical area in the glabella, you're treating about 20 units on average of either Botox, Xeomin, or Jeuveau. So for Dysport, you're going to be injecting 50 units into the same area. Now, preparation. Anesthesia, quite honestly, I don't really use anything in most of my patients. It is a very comfortable procedure. I use insulin syringes when I'm treating. So going back to reconstitution, FDA approved guidelines are the 2.5. I started off with the 2.5 reconstitution, and then I went down to 1.0 because I wanted something a little bit more. I wanted my dispersion to be a little bit tighter. And then once I started using Jeuveau, when they came out with that neuromodulator, I actually increased my dosing to 2.0. Makes the math a lot easier, and the product works so well. And so because of that, because I have a smaller, because I'm using the 2 cc reconstitution, I'm using a 0.5 cc insulin syringe, and it makes the treatment much more comfortable for the patient. So I would recommend, if you can use an insulin syringe, or you want to make sure that you're using like a 30 gauge needle, 1/2 inch, to make it as comfortable as possible at the very least. So when they come in, you're going to go ahead and have them seated with their head planted nicely and firmly into the headrest. Patients do kind of have a tendency to move forward, so you want to ask them nicely to put their head back. You're going to go ahead and identify the glabellar complex without facial expression and then with facial expression. And you're going to identify your injection points at that time. So you'll cleanse the skin with alcohol, allow it to dry before you make any injections. You can do your marks at that point, make your marks at that point, and you'll draw up your 20 units of either Botox, Xeomin, or Jeuveau, and you can draw up 50 units of Dysport. Now, as a newer injector, this is a great place to start. But really, I think it's a great idea for you to really make notate good notes in your chart on muscle movement. Is one side stronger than the other? When they come back in for their follow-up, are they not having full relaxation? All these things are going to make you a better injector. So you will vary your injections. Now, as you become more experienced, you'll be able to see a weaker glabellar complex and say, okay, this person, she really does not need, or he doesn't really need 20 units. We can maybe get away with 16 units or 14 units. I've used as little as 8 units in the glabella. So you're going to, slowly learn the dosing, but 20 units is a very safe and good place to be at. And then you can go as high as 35 to 40 units in the glabellar complex, especially in men. So pay attention and make sure you're making your notes so that you can become a better injector. Now, injection technique, you want to make sure that you're staying within your safety zone. So if you take a look at the bottom photo there, where the yellow area is kind of marked out there, that's going to be the safest place to inject when you're treating the glabellar lines. So you're going to make sure that you're 1 centimeter above the orbital ridge, and you want to also make sure that you're medial to the lateral limbus line when you're injecting. And then you want to stay right in that zone. So as long as you're in that safe zone, you're going to inject your treatment is going to be very nice. You're going to go ahead and have them make that angry face, and you'll see their procerus kind of pull down, and you're going to grasp that procerus muscle and with your non-injecting hand, and then you're going to inject very slowly and deep. You'll inject deep into the muscle, and then very slowly you can inject 4 units of either Botox, Xeomin, or Jeuveau, or 10 units of Dysport straight into the procerus. And then go ahead and take a step back and have them make that angry face again. I have each patient animate almost with every injection point. If you're having them animate and then you mark them out, even if they're marked out or not, every time I'm just rechecking myself. So you're going to go ahead and make them make that angry face again. Confirm that you can see the head of their corrugator muscle, and you're going to pinch with your thumb on the orbital ridge there, and then with your pointer finger above, and you'll be making a deep injection right into the head of the corrugator. And again, you can do 4 units in that place with the Botox, Xeomin, or Jeuveau, or 10 units of Dysport. And you're going to repeat that on the right and left side. Now for the tail end of the depressor muscle, you're going to inject coming in from a lateral approach. And this is going to be a very superficial injection because that muscle does come up and above. So you want to make sure that you're not going too deep, because you can actually cause a lid drop there. So you want to make sure that you are, brow drop there. You do want to make sure that you're 1 centimeter above that orbital rim and that you are medial to the lateral limbus line. So as long as you're in that zone, you're going to be very safe, and superficial is good as well. So you're going to go ahead and drop your 4 units very superficially of Botox, Xeomin, or Jeuveau, and then 10 units of Dysport, 1 on the right, 1 on the left. And so we're doing 5 injection points with Dysport resulting in 50 units, and 5 injection points with either Botox, Xeomin, and Jeuveau with a total of 20 units. Now, as you progress, you're going to see, that maybe you'll need a little bit more, a little bit less, like I said before, but anywhere from 8 being the very, very minimum, and then 35, but average 20 units. Now, I recommend every patient comes back 2 weeks post their treatment. This is going to be great for you to reassess and see what kind of treatment you gave them. They should have full relaxation at that point. If they still have some movement, just go ahead and take a look. Where is that movement coming from? Is it coming from the head of the corrugator? Is it coming from the tail end of the depressor muscle? Is it coming from that procerus muscle when they pull down? And then just you can go ahead and add onto that movement the same way you did with your first injection. You can add 1 to 2 units per area if it's very strong. If you're really seeing that movement very actively, then you can go another 3 to 4 units. But typically 1 to 2 units per injection site is more than enough for follow-up. And you should see full relaxation 2 weeks later. Now, if you did make that adjustment to their dosing, then you can go ahead and make sure that you adjust that at their retreatment in 3 months. Complications. So droopy eyelid, I think that's something everyone's always so nervous about with Botox and any neuromodulator. It is a temporary, complication. So it will resolve in about 6 to 12 weeks. It's not going to be fun for the patient. It's not going to be fun for you, but it'll be a great learning lesson. And you hopefully won't have that issue again. But if you do, you can go ahead and prescribe them Upneek. It helps the contraction of the Mueller's muscle there. So it will actually cause the upper lid to lift up about 1 to 2 millimeters. So they can wear that and put a drop in the affected eye, and that'll get them by. It works about 8 hours, so they can, put it on in the morning, and then if they have an evening event, they can put it on again in the evening if it's really troubling them. Now, eyebrow ptosis is a little bit different. Sometimes we're able to treat the lateral eyebrow and kind of give a little bit of lift with a couple, 1 to 2 units or so. But more often than not, you know, if you get a true brow drop, you're just going to have to wait until that resolves, and that takes about 6 to 12 weeks. And that just means that, you know, perhaps the patient's anatomy was slightly off, or you know, perhaps you injected too lateral to the, lateral to the limbus line. So, you know, just be cautious of that when you're doing your injections. You know, you can always, if you're starting off, you can always start with a lower dose. You know, you can do 2 units rather than 4 units in that area until you're feeling more comfortable. If you're seeing full, you know, a very soft muscle, then you can do that, you know, a lighter dosing, and that's going to give you a nice treatment. And you're going to be safer. So when should these patients return? I have everybody come back at 3 months. I do have some patients that come back at 3 months and they are still fully relaxed, no movement. So I'll push them out another month. You know, why would you retreat them if they still have full movement? If they come back at 4 months and they have full movement, then you can go ahead and treat them. Or if they even have a little bit of movement, you can retreat them at that point, and you're going to retreat them with the same dosing that you did initially. So at their follow-up visit, of course, unless you readjusted their treatment at their follow-up visit from the initial treatment, right? So if you did increase their dosing, make sure that you do increase their dosing at their retreatment appointment. And this way, hopefully they won't have to come in for 2-week follow-up after that. So I hope you guys enjoyed this. If you have any questions, please feel free to reach out to me at skincare@galiderm.com or on my Instagram at Galiderm Aesthetics. I hope you guys have a wonderful day.